Certainly here at Hopkins, our numbers are up significantly as far as off the baseline, we're over 2 times our normal numbers. And again, those numbers are not patients who have severe illness. Those are patients that have fever, who have cough, who have congestion, and very worried families. So I think that certainly we're seeing significantly increased numbers, and I think there is some confusion because of the significant amount of media coverage that's been there for families. And I think that our hope is to allay some of the fear and sort of translate some of that confusion into common sense.
I'm sorry. I think in addition to that, pediatricians in practice are seeing very similar patterns. I think a lot of people have anxiety and concerns. They might want to consider calling their doctor even before they go to the office, because a lot of people have set up triage systems and can provide lots of good information and guidance over the phone, which would save the parent having to bring a sick child to the doctor's office where they may infect another child or get something else while they're there. So I think maybe a first round phone call screen to a physician's office before they either go to the doctor or go to the ER is appropriate for most otherwise well children.
At the University of Maryland, we've had similar experiences in increasing pediatric emergency department visits, but we have to also remember that seasonality is one of the principles in pediatric infectious illnesses. Seasonal respiratory surges are not uncommon. Respiratory syncytial virus or regular influenza viruses certainly have their peaks, and we've been, as many centers have, been planning for this for many months. We have tiered services, urgent care and fast track facilities that are addressing the patients with milder illness, still allowing the core emergency department to attend the children who may need additional treatment. So a lot of preparation and planning has gone into it, knowing full well that the seasonality of the regular respiratory viruses is upcoming, but also knowing from the experiences of Southern Hemisphere what we may expect for anxieties and real illnesses associated with H1N1. So the planning has certainly helped us manage the population very well.
I'd also like to add, for parents who are concerned about their children's health, who have children who have higher risk of complications for any influenza, children who are very young or children with chronic medical conditions, it's not unreasonable to contact your pediatrician and discuss with them a plan. If my child has these symptoms, what should I do? Should I get medicine? Should I come in for an office visit? Should I go to the emergency room? And they, knowing your child and their medical condition, can give advice about how to best guide you should your child become ill.
There is going to be abundant messaging that will make it convenient for the general public to find out the closest location. And when I say the general public, I'm specifying really the higher risk populations, because those are the initial groups which will be receiving this. There's going to be abundant vaccine. It's going to be rolling out gradually, and everyone who wants the product will be receiving it. But the front of the line, we're asking folks to defer who are not in the higher priority groups. But that is going to be available by website. People will be able to see where they can get doses, and that is under development right now. And we do have a website, baltimorehealth.org, for the City Health Department, which has clinics on it. Right now it's the October schedule, and there is information about seasonal product right now, which is available for everyone, and there will be future information about the H1 products as well.
Additionally, the state has a website, www.flu.maryland.gov, and there's a lot of information about influenza and also about the vaccine, and that is being updated very frequently as we are able to put new information on about the vaccine and about where the vaccine is located. Where it's located is not on the website yet, but it's under development.
I just wanted to add that the emergency department is not a place that has the ability to give routine vaccination. So families who are looking for that from our emergency department, that's not something that the emergency department can do in a routine fashion.
And with regard to that, the city effort for vaccination, where we do have significant capacity to immunize large numbers of people, is a trifold one. The best place to be immunized, as always, whether you're a child or an adult, is your own medical home by your own physician. If for whatever reason that's not feasible, there are two other possibilities. One is in the public sector through our public health clinics at our regular fixed sites, plus at community-based clinics, and that's mentioned on the BaltimoreHealth.org website. And then the other opportunity for children will be in school-based clinics, which are going to be rolled out shortly, and details are going to follow about that.
So we know from the past there have been influenza pandemics before where there's been a significant increase in the number of cases in the fall, and the vaccine has been delayed. And as the peak comes down, people think, oh, we don't need to go out and get the vaccine. But then there's been a resurgence in the late winter, say March or February. So I think we don't know exactly with this virus what to expect. It came in the spring. It came back quickly when school got back in. We don't know what's going to happen in the spring. So like we say with seasonal influenza in general, it's not too late to get the vaccine. So I think even if you don't get it in the first round, November, December would not be too late to get the vaccine to protect you for the spring.
You have to also remember that most individuals are diagnosed with influenza-like illness simply because many viruses can give you very similar symptoms. So though you may feel that you've had an influenza infection, you may have had one of the multitude of other respiratory infectious viruses that are prevalent regularly this season in the community. And it's important to still be ready and know well that there are many other viruses that you may be exposed to.
That's actually a question I've gotten a lot, so I just want to reiterate that. We've gotten a lot of questions of people who said that in the spring they had an influenza-like illness, should they get the vaccine? Unless the current recommendations are, unless you have had confirmed H1N1 virus, you should still get the H1N1 vaccine.
In addition to relying on the bathrooms, which is the obvious place to look for soap and cleansing materials, all of the schools have positioned hand wash dispensers at locations throughout the school, including the front entrance by the cafeteria and a few other places, and those are being maintained. In addition, the health department is going out and making spot checks on schools. We've just started to do that, and there are remediations that are being requested. So that is something that we are keeping tabs on.